Magic 91.5, Chuck Taylor here with you. A good morning. Hope you're having a great one. It's a beautiful Tuesday morning. The sun is out and all things are just coming together and we have great information. And one of the things I always tell you is I'm all about your health. I'm all about your well-being. And I have somebody here, Dr. Jamie, who is just about that. Good morning to you, sir. How you doing this morning?
Good morning. I'm very well, thank you.
And so not a stranger to the idea that we're talking about. Your official title is a specialist knee surgeon over at the Cayman Orthopedic Group. Am I correct in saying that?
That's right, yeah. I'm an orthopedic surgeon, which means I've been trained in the whole of orthopedics, which is bone and joint and musculoskeletal surgery. But I'm a specialist in knee surgery and sports injuries. Exactly.
And just jumping into it, we have I want to say over the course of the last few years, we have a community that is very active now. Super, I want to say like just athletic wise, looking from the idea of, university, we have some really great athletic people in our local community, but we get hurt.
That's exactly right.
We get hurt. We push the limits and we train our bodies and we get hurt. How can you help us?
Well, I think there's plenty that an orthopaedic surgeon can do for a sporting population. I have to say, when I've been out walking, enjoying coming back to the island, it's amazing to see how many fit, athletic-looking folk you've got around running in this incredible heat. My goodness, I wouldn't fancy this myself. But no, you're right. People like to keep fit and they sustain injuries. Injuries are part of sport. I work with professional sport in the UK, with professional rugby and professional football. Soccer, I think you'd call it, but yes. I'd call it football.
Yes. Mix and match.
Yeah, we can still get along. But you're right, injuries are part of sport. And what's really interesting, I think, to see is that inadequate training causes injuries, excessive training causes injuries, and sport causes injuries. And my role really is to try and minimise the impact of those injuries on an athlete's performance and their ultimate participation. I know how important it is mentally and physically to maintain a sporting profile. I enjoyed sport myself, and I think that's really what gives a lot of orthopaedic surgeons who often come from a sporting background their passion, really, that they know how important it is. And if you lose that ability to get away from it, to enjoy the fantastic irrelevance of sport, that just takes you away from the day-to-day work that we're all committed to. I know how important, how impactful that can be.
Exactly. And I mean, you're, as I said, not new to this, 22 years of doing this, sports injury. Is it knee replacement, ACL? Tell me a little bit more, get a little bit deeper into the specific names there, because I know a lot of our community are well versed. I'll be watching him say, oh yeah, he had his ACL torn. Tell me a little bit about that, what that is.
Yeah, so I deal with all aspects of knee surgery, which means we're very lucky we get to deal with the younger sports folk, although young can nowadays mean anything up to 65, can't it?
Yes.
But we also deal with degenerate knee conditions such as knee replacement. ACL injury, anterior cruciate ligament injury, is massively important. It's a huge day for that athlete and a huge day for their knee, unfortunately. It's generally an injury to the ligament in the middle of the knee sustained with a non-contact or minor contact twisting injury. So things like football, netball, skiing, all very high risk. Your risk of getting an ACL injury when you're skiing is 1 in 1,000 per day that you're skiing.
Wow.
Yeah, it's shocking. And some sports are higher risk than others, but anything that involves a foot that's particularly with a pivot, like a big ski on it, for example, or a foot planted in the ground with studs on good fitting footwear, your risk of injury to the ACL is significant. The problem is not just the ACL that's injured, but it's the other structures in the knee that get damaged at the same time. The meniscal cartilages, which are the load distributing cartilages sitting in the knee, the articular cartilage, and the capsule itself. And if you injure your ACL, your risk of arthritis goes up by about 16 times.
And you kind of prelude to something that I wanted to talk about, early arthritis. We find that more now due to health issues and eating, different things of that nature. How important is that early detection and dealing with that? Tell me a little bit about that.
Well, trying to get onto any disease early is really important, and arthritis is just that. It's a disease. It's a disease that we know we can do a lot to stay away from or to slow down. And there's things that we can do personally in our general well-being, keeping our weight down, keeping our activity levels good. People think of it as wear and tear, a bit like you're wearing out the tread on a tyre, but the truth is actually using your knees is good for your knees. There's no evidence that sport itself causes arthritis. Sport is associated with injuries. Injuries associated with arthritis. So staying fit, staying active, staying slim, very important. But the moment you've picked up some kind of problem, a localized cartilage defect, we know that they tend to get bigger. So if you can offload it, if you can reconstruct or repair it, your chance of staying away from arthritis or delaying arthritis is potentially very good.
And that is definitely one of the things that preventive is really what you try to make sure that the listening public understands, that this is part of the key of being healthy is, hey, you know what? Make sure it doesn't get to that point, because when it gets to that point, really there's no turning back. You just got to try to maintain it at that point. Would that be correct in saying that?
That's absolutely true. And you're right. When a hole in the articular cartilage, that nice, smooth, white, shiny stuff on the end of bones that means that they can move one on the other. When you get a little hole or an ulcer in that cartilage, it tends to get bigger. It tends to get bigger because of increased contact pressures and general deterioration of the environment in the joint. And anything we can do to try and get involved early to fill in that hole or to offload that hole with surgery sometimes is potentially beneficial.
Really, really good. If you need to get in contact with the Cayman Orthopedic Group, the number that you need to have, and folks, I'll repeat this throughout the show, is 945-8380. And you can book to see Dr. Jamie. You're here from your March 25th until, I think, 31st, something like that. We can do appointments during that time frame.
That's right. But I came, a couple of months ago for a stint, and we met then, which was great. And I'll be back on a regular basis. So happy to meet up anytime.
Perfect. So, folks, be forewarned, get in and make sure you stay healthy, stay fit, and this is a great part of it. Dr. Jamie, thank you so much for stopping by here. If you need the number, you could reach out to me. You know I'm here 247 for you. And remember, the Cayman Orthopedic Group, their number is 945-8380. Thank you so much, sir, for stopping by. And don't be a stranger. It takes so long to stop by.
Pleasure to see you again.